Gentlemen, let me ask you something personal but important. Have you ever had that moment where you wanted your body to respond, but your erection just wasn't as firm or it faded too quickly? It can be frustrating, sometimes even embarrassing, and it makes a lot of men think, maybe I'm just getting old, maybe this is my new normal. But here's the truth, you are not powerless. Yes, pills can help in the short term, but there are natural, science-backed exercises that can strengthen your erections, improve blood flow, and give you back that confidence in the bedroom without depending entirely on medication. And today, I'm going to walk you through 3 powerful methods that can do exactly that. The last one, almost nobody talks about it, but it may just be the hidden gem that can change everything. I'm Dr. Mariana, a specialist in men's health and integrative wellness with over 15 years of experience working with thousands of men on exactly these issues. I've dedicated my career to helping men understand that their bodies are not failing them. They're simply asking for a different kind of attention. And when you learn how to give your body what it needs, everything changes. Now, before we dive in, I'd love for you to do 2 quick things. Hit the like button if you care about men's health, and in the comments, tell me where you're watching from today. I always enjoy seeing our community grow around the world. And of course, make sure you subscribe so you don't miss my weekly tips for improving your vitality, intimacy, and confidence. All right, let's get started. First, let's clear up a myth that I hear far too often. A lot of men think erections are purely about testosterone, or that if they're struggling, it must be all in their head. That's not the full story, not even close. Yes, hormones and psychology matter. Your mindset, your stress levels, your emotional connection with your partner, all of these play a role. But biologically, an erection is fundamentally a vascular event. Let me explain what I mean by that. Your arteries bring oxygen-rich blood into the penis. Your erectile tissue, made up of spongy chambers called the corpora cavernosa, traps that blood. And your veins keep it there until release. It's a beautifully coordinated system when everything is working properly. But if those blood vessels aren't healthy, if they've become stiff or narrowed over time, or if the muscles that support them are weak, your erection can struggle no matter how high your desire is. This is why so many men feel confused. They still have the drive, they still feel attracted to their partner, but their body doesn't respond the way it used to. And they blame themselves. They think something is fundamentally wrong with them. But that's not true. The system simply needs support. It needs to be retrained, strengthened, and nourished. So instead of only thinking about hormones or pills, we have to think about vascular health and pelvic strength. That's where the 3 exercises I'm about to share come in. These are methods I've used with patients for years, and I've watched them transform not just erections, but confidence, relationships, and overall quality of life. Now, I know what some of you are thinking. Kegels? Aren't those for women? Not at all. In fact, strengthening your pelvic floor muscles is one of the most effective, natural ways to boost erection quality. And yet, most men have never even heard of it. This is one of the best-kept secrets in men's health, and I'm always surprised it isn't talked about more. Here's why it matters so much. Biologically, your pelvic floor muscles wrap around the base of your penis and support the blood vessels that trap blood inside during an erection. Think of them as the foundation of a house. If the foundation is weak, the whole structure becomes unstable. If those muscles are weak, blood leaks out too quickly. Your erection fades before you want it to. But if they're strong, you can hold a firmer, longer-lasting erection with more control. I remember a patient named Michael, 64 years old, a retired engineer. He came to me frustrated because his erections had become unpredictable. Sometimes they were fine. Other times, they would fade right in the middle of intimacy. He felt embarrassed and started avoiding closeness with his wife altogether. When I introduced him to pelvic floor training, he was skeptical. He said, "Doctor, I've been lifting weights my whole life. How is squeezing some invisible muscle going to help?" But he trusted me and gave it a try. Within 6 weeks, he called me with excitement in his voice. He said, "I don't know how to explain it, but I feel in control again. It's like I got a part of myself back." That's the emotional benefit of this exercise. It gives you a sense of control. No more worrying mid-intimacy about losing your erection. No more anxiety creeping in at the worst moment. You feel confident because you've built strength where it matters most. And practically, It's something you can do discreetly anywhere. No one knows you're doing it. You could be sitting in traffic, watching television, or lying in bed before sleep. Here's how to do it properly. First, find the muscles. Next time you urinate, try stopping the flow midstream. The muscles you just used to do that, that's your pelvic floor. Once you know where they are, you don't need to do this during urination again. It's just a way to locate them. Second, practice the contraction. Contract those muscles for 5 seconds, then relax for 5 seconds. That's 1 rep. Do 10 reps, 2 to 3 sets per day. As you get stronger, you can increase the hold time to 10 seconds. Third, stay consistent. This is the most important part. Most men notice improvement in 4 to 6 weeks. Firmer erections, better ejaculation control, even more intense orgasms. But you have to show up every day. Think of it as strength training, but for your most important muscle group. One patient told me after 3 months, "I wish someone had told me about this 20 years ago." And honestly, I wish the same. This simple exercise could spare so many men years of frustration and self-doubt. Now, don't roll your eyes. I know what you might be thinking, but this isn't some late-night infomercial gimmick. Vacuum therapy, or using a penile pump, is a clinically proven, doctor-recommended method. It's used in hospitals and urology clinics around the world, especially for men recovering from prostate surgery or those struggling with erectile dysfunction. Here's how it works. You place a cylinder over your penis. Using a hand pump or battery-powered device, you create a gentle vacuum that draws blood into the erectile tissue. Once you achieve an erection, a soft constriction ring can be placed at the base to help maintain it during intercourse. Biologically, this does several important things. First, it expands the erectile tissue, keeping it flexible and responsive. Second, it improves oxygenation. Blood carries oxygen, and when that oxygen reaches the penile tissue regularly, it stays healthier. Third, it trains your blood vessels to respond better over time. Think of it like physical therapy for your vascular system. Emotionally, vacuum therapy gives you confidence. You know you have a reliable tool when you need it. You're not left wondering if your body will cooperate. That peace of mind alone can reduce the anxiety that often makes erectile difficulties worse. And practically, it's simple. Most men use it for 10 to 15 minutes, 2 to 3 times per week. Some use it just before intimacy. Others use it as part of a daily routine to maintain tissue health. I remember working with a man named George, 68 years old, who had undergone prostate surgery 2 years earlier. His surgeon had told him he might never have natural erections again. When George came to me, he was heartbroken. He said, "I feel like I've lost a part of who I am." I introduced him to vacuum therapy as part of his rehabilitation program. At first, he was hesitant, but after a few weeks of consistent use, he started noticing changes. The tissue was responding, blood was flowing, and after 3 months, he experienced his first spontaneous erection since the surgery. He called me in tears. He said, "I never thought this would be possible again." That's the power of this tool when used correctly. A word of caution. Pumps are safe when used properly, but if misused, they can cause bruising, discomfort, or even injury. So talk to a specialist before starting, and always start slow. Never overpump or use excessive pressure. Think of it as gentle rehabilitation, not aggressive treatment. When used right, vacuum therapy not only works on its own, it can also enhance the effectiveness of medications like tadalafil or sildenafil. When combined, many men find they need lower doses of medication, or can eventually reduce their dependence on pills altogether. Here's the one hardly anyone talks about, yet it's one of the most powerful tools for long-term sexual health, and I think it deserves far more attention than it gets. Penile traction devices, also called extenders, aren't just for cosmetic lengthening. That's a common misconception. They're actually used in urology clinics and by sexual health physiotherapists to improve vascular health and tissue elasticity. This is rehabilitation at the cellular level. Here's what happens biologically. When you apply gentle, sustained traction to the penile tissue, you stimulate a process called mechanotransduction. That's a scientific term for how cells respond to physical stress by growing and adapting. In this case, gentle stretching stimulates new blood vessel growth, a process called angiogenesis. It also increases elasticity in the erectile tissue, making it more responsive during arousal. Over time, this supports firmer, healthier erections. Studies have shown that 1 to 2 hours per day, consistently for 3 to 6 months, can significantly improve erection quality. Some men even see modest length gains as a secondary benefit. Emotionally, this gives back a sense of vitality and hope. Many men who use traction therapy tell me they feel like they're actively doing something to improve their health. They're not just waiting for a pill to work or hoping things get better on their own. They're taking control. Practically, it requires discipline. This is not a quick fix, it's a commitment. But if you stay consistent, the long-term results can be remarkable. I worked with a patient named Daniel, 59 years old, who had noticed his erections becoming less firm over several years. He wasn't interested in taking medication long-term, and he wanted to explore natural options. I introduced him to traction therapy as part of a comprehensive plan that included pelvic floor training and lifestyle changes. He was diligent. He used the device for about 90 minutes each day while working from home. After 4 months, he told me, "My erections feel stronger than they have in a decade, and I did it myself. That feels incredible." One important warning: proper fit and gradual traction are crucial. Don't buy a cheap device online and crank it up to the highest setting. That's a recipe for injury. Think of this like physical therapy. You wouldn't start running marathons after a knee surgery. You build up slowly. Work with a professional to ensure you're using the device correctly and safely. So, let's put it all together. How do you use these 3 methods in your daily life? Start with pelvic floor training. This is your foundation. 10 reps, 2 to 3 times a day. No equipment needed. No excuses. You can do this anywhere, anytime. Make it as automatic as brushing your teeth. Add vacuum therapy. 2 to 3 short sessions per week to keep blood flow strong and tissue healthy. Use it as part of your routine or before intimacy for an added boost. Commit to traction therapy if you're serious about long-term vascular and tissue health. This requires more time and dedication, but the rewards are worth it for men who want lasting results. Layered together, these 3 methods tackle the problem from every angle: muscular strength, blood flow, and tissue health. They work synergistically. Each one supports and enhances the others. And remember, it's not about quick fixes. It's about building a foundation for years of reliable, confident performance. Now, I know some of you might be feeling discouraged. Maybe you've tried pills and they didn't work as well as you hoped. Maybe you've had disappointments in the bedroom that left you feeling defeated. Maybe you've even started avoiding intimacy out of fear of failure. Let me reassure you of something important. Struggling with erections does not make you broken. It makes you human. And the fact that you're here, watching this, learning, seeking answers, that tells me something powerful about you. You're not ready to give up. You still believe that better days are possible. And you're right. Biologically, your body is capable of change at any age. Blood vessels can strengthen, muscles can grow, tissue can adapt and regenerate. The human body is remarkable in its ability to heal when given the right conditions. Emotionally, you deserve intimacy, connection, and confidence, no matter your age. These are not luxuries reserved for young men. They are part of a full, meaningful life, and you have every right to pursue them. And practically, these exercises give you tools you can start today, not next week, not after your next doctor's appointment, today. Gentlemen, I want you to understand something profound. Your erections are not just about sex. They're about health, vitality, and quality of life. The strength of your erection is often a window into your cardiovascular health. It reflects how well blood is flowing through your entire body. When you improve your erectile function through these natural methods, you're also improving your heart health, your energy levels, your mental clarity. The stronger your pelvic floor, the better your blood flow. The more resilient your tissue, the more confident, energetic, and connected you'll feel in every part of your life. This ripples outward into your relationships, your work, your sense of self. So here's my challenge to you. Pick one of these exercises and start today, even if it's just 10 pelvic floor squeezes before bed. Small steps add up. Consistency beats intensity every time. If you found this valuable, please hit that like button, subscribe to this channel, and share this video with a friend who could use a boost. And tell me in the comments, Which of the 3 exercises are you going to try first? I read every comment and I love hearing from you. This is Dr. Mariana reminding you that age is not the end of vitality. With the right habits, the right knowledge, and the right commitment, your best years of intimacy, confidence, and freedom can still be ahead of you. Stay strong, stay hopeful, and I'll see you in the next one. Remove these words.